Hello, and thank you for viewing my presentation. During this presentation, I'll be discussing uh, the idea of changing from the athletic model to the patient/athlete centered model of athletic training delivery. And what we'll be talking about here is the attempt to change from the traditional model to a more patient/athlete oriented model of delivery of athletic training services, specifically at the secondary school and collegiate levels. So, as an athletic trainer, I'm sure all would be excited if we could come up with ways to utilize more advanced technologies, spend more time with our family and loved ones, and increase our compensation for our positions and the hard work that we do. I'm sure that sounds like a fantasy to a lot of people. However, Princeton University, Boston University, Dartmouth University, Kutztown University, as well as the University of North Carolina at Chapel Hill, have all experienced this part or all of those advantages that we mentioned in the previous slide by altering the way that they deliver athletic training care at their respective organizations. Obviously, this gentleman is extremely gifted and talented at his job, which is coaching football players. However, I don't think he is qualified to evaluate healthcare of his patients from a medical standpoint. This gentleman, however, is extremely experienced and qualified and competent and able to evaluate the quality of healthcare. The difference between these two guys is the gentleman on the left is a football coach and the gentleman on the right is a physician. So it stands to reason that as healthcare providers, athletic trainers um, should have the oversight from medical professionals as opposed to coaches and or administrators. So seems like a really simple concept. How do we make this change? How do we make the change from the traditional model of healthcare in which athletic trainers are housed in athletic departments, have direct oversight by administrators and coaches, um, and change to a more patient or athlete centered um, model of delivery of healthcare. So, utilizing the techniques found in our text for the class, I'm going to go through and discuss my thoughts and ideas on how to make this change possible. First, we start off with the writer, the the rational part of the conversation, and also the decision maker for this change. So, in the scenario presented currently, it's important to help the writer understand what we're trying to accomplish, help that writer understand the model of what we're trying to do, and help that writer also understand and be able to build upon the examples that have been laid forward. And earlier in the presentation, I mentioned a number of examples of organizations that have successfully made the transition from the traditional athletic model to the um, patient or athlete centered model that we're discussing here. Uh, but ultimately, in this process, change has to be made. You have to go ahead and jump in both feet. Um, and I think it's important that that writer understands that even in the process of digesting information and attempting to make a decision, that at some point in time, a decision has to be made and a direction has to be followed. Specific to the example given, it's important that communication lines are kept open between administrators, coaches, as well as the healthcare staff and physicians overseeing them to help them understand the change, why the change is occurring, and the benefits of that change to all parties involved. The elephant in this situation has to understand again the benefits of what exactly is going on, understanding that first and foremost, that by altering the delivery of healthcare, uh, the patient is going to benefit from a larger variety of professionals able to provide care for them, easier access to the overall healthcare organization at that university or secondary school level, or the team, the healthcare team that is providing care for the group of patients. Uh, and I think it's important to allow those people who are involved in this process to digest this change little by little, and to be invested in the change, to understand the good that's trying to come about by this change. The third part of this change process is shaping the path. And again, that's going to include easing the fears that inferior care will be provided. Help all those understand that the same providers will be providing the same quality of care, actually a higher quality of care. Um, uh, Allow these changes to happen, and allow expectations of coaches, administrators, and even healthcare providers to shift, to understand what this new um, delivery system of healthcare will look like, and what those benefits will be. So, in all, how do we know that the change has successfully been made? How do we know that we've gone from one type of healthcare to ultimately that patient becomes the center of the healthcare? The conflict of interest that potentially could exist by having healthcare be have direct oversight by administrators is gone, and the quality of life of all those involved has improved. Thank you very much.